Policy can sometimes seem like a messy system of stakeholders and organizations, and it's no wonder that people are often left wondering where they fit within the system and how they can make a difference. Take, for example, the field of global health. There are many different organizations working within the field of global health, each doing their part to influence the entire field or policy system. Each of these global health organizations, or actors, work at all different levels, from the local and district or state levels to the national and international levels. Some of these organizations are affiliated with governments and some are private. Some draft laws, some create policies, some provide funding, and some provide direct services by implementing programs. So, where does your work fit within this complex policy system? And more importantly, how can you work within it to make a meaningful difference? This is where policy field analysis comes in handy. Policy field analysis is a mapping exercise where you identify all the organizations and stakeholders that make up the system or policy field in which you are working, and examine the relationships between them. To begin, you'll need to clearly define the specific issue or topic you are trying to understand. We'll stick with the more general example of global health, but you may choose something more specific. This could be a specific health issue or disease, a piece of legislation, or a program or project of interest. Next, you'll outline the levels of the system. If you're not sure where to start, try starting with the local level and work your way up. The local level includes the smallest geographic area that you are interested in. It could be a particular community, city, or district. Organizations at this level might include local farms, community and district health offices, or city councils. The next level is the state or provincial level. Organizations working at this level typically include state or provincial offices, such as the New York State Department of Health, a provincial health office, or the state legislature. The next level, the national or federal level, includes organizations that work for or across the country. Examples may include the U.S. Department of Health and Human Services, the Centers for Disease Control and Prevention, U.S. Congress, or National Parliament. Finally, the last level is the international level. Examples include the World Health Organization, the World Bank, and the Food and Agriculture Organization of the United Nations. Now that we've defined our issue or topic and the different levels of this policy field, we can start placing relevant organizations or stakeholders within the policy field. In some cases, it will be clear in which level a particular organization belongs. In cases where it's unclear, try to think about how these organizations work in the context of your specific issue. For example, a major foundation that is based in the US and works in many countries could be placed in either the national or international level. If, for your particular topic, this foundation works closely with many international organizations, you may wish to place this foundation in the international level. But if you are creating a policy field for a domestic health issue or problem, it might make more sense to put the foundation in the national level. Once we have a pretty good sense of all of the different organizations involved in our policy field, we can begin to map the relationships between them. There are two important relationships to note: influence and funding relationships. Funding relationships represent a flow of funds from one organization to another. These are represented by dashed lines. Influence relationships denote some form of collaboration and information sharing. These are represented by continuous lines. Let's look at an example of an influence relationship. Global health policy is made primarily by the World Health Organization during their annual World Health Assembly. The WHO then shares its policies and guidelines with national governments, or more specifically, their ministries or departments of health, who decide how and when to use them. By creating global health policy, the World Health Organization is influencing the work of the Ministry of Health, so we can draw a continuous line from the World Health Organization to the MOH. If there is a specific program or policy that connects these organizations in your policy field, you may wish to write that program or policy name along the line. For example, in this case, The National Ministry of Health follows the WHO's international health regulations. Now let's look at funding relationships, which are represented by a dotted line. Let's say the WHO has some funding for training government health officials on WHO's international health regulations. We can draw a dashed line from WHO to a country's Ministry of Health to indicate this funding relationship. The Ministry of Health then gives some of these funds to an international non-governmental organization, a state health department, and a district health office to conduct the trainings. Now we can see how funding is flowing through our system. You can continue adding organizations and drawing the relationships between them until your policy field map is complete. Please note that we are using generic examples within the field of global health. You'll want to be as specific as possible when creating your own policy field map. Now, you may stop here, or you may wish to add more information. For example, you could add some specific outputs or outcomes of your program or policy, as we have done here for the IHR training program example. You could also add to your policy field map by providing examples of what outside influences might affect the operation of this particular policy system. As a review, there are 4 steps to creating a basic policy field map. 1. Identify the issue. 2. Identify the levels of the policy field. 3. Add organizations to the map. And 4. Show relationships between the organizations. You may add 1 or 2 more steps to show anticipated outputs and outcomes, or identify any relevant external influences. In summary, policy field analysis is a simple way of demystifying a complex network of organizations, policies, programs, and the relationships between them. This tool can be used to map a variety of policy issues and programs. Whether you are developing policy recommendations, trying to understand a particular program, or analyzing your policy communication audience, policy field analysis can support you to think beyond your role and your individual organization.